it's about to go down. I said, y'all, it's about to go down.
Good evening. What's going on Facebook? What's going on YouTube? This is your boy Steve Belcher. Welcome to another edition of Kidney Disease Education Moment. Man, how's everyone doing out there? Hope everyone is staying safe. Just doing what they need to do to get through these uncertain times. I'm just taking it one day at a time. Tonight, I'm telling you, this is a good broadcast, especially for warriors who just started dialysis. Maybe you have a family member that just recently got a vascular access. You may even got a vascular access. Well, if that's the case, this show is for you tonight. Share this broadcast. I'm serious because, again, we've done many shows like this. You can go back and look in the archive, but we always got to keep re-bringing it up. I could have just easily just put out an old broadcast of one of the shows that we talked about, but this is what I do to keep myself active during these crises. So thank you for joining the show. Again, share this broadcast. Again, we're going to talk about just the facts, vascular access. Now, you may be asking me, and I'm sure a lot of people watching this know what a vascular access is. But for people who don't know, a vascular access is a way to reach the blood vessels for hemodialysis. There are three types. There's a fistula, and the fistula is your artery and vein sewed together. Blood from the artery makes the vein thicker so it can be used for dialysis. A fistula is often the longest lasting access. That's the preferred access is a fistula. You may have kidney disease and be in stage 4 or 5 and haven't gotten your access yet. This show is for you because you can determine if you want a fistula, you want a graft, or you may need to stay with a catheter depending on your veins. But the fistula is the preferred access because it's using your natural veins as the access. So again, a fistula is your artery and your vein sewed together. Blood from the artery makes the vein thicker so that it can be used for dialysis. And again, a fistula is often the longest access, but when you're using a fistula or any access or graft, once the access is ready for dialysis, you get cannulated with these needles. And we normally start with the 17 gauge needle. And that's what this is right here. This is the smallest, even though the gauge size is the largest. But when you look at the needle, it's the smallest, even though it's a 17 gauge needle. It's the smallest of the needles. There we go. That's the smallest where we start patients off with that has a fistula. We use the 17 gauge needle with the butterfly. This is the cannula needle, right? All right, there you go. This is the cannula needle. And so here go the clamp right here. Once we cannulate, and we let the blood flow down. We see the flashback. We clamp right here, right? And then we unscrew this cap to connect it to the dialysis lines. Now, this piece right here, this, it's when you pull a needle out, right? When the needle is in the arm, right? When you pull it out, this goes in like this, all the way down. It's a needle guard, so the technician doesn't get stuck. You see how the needle retracts in, and then it's a piece down here where it locks the wing right in there. It locks, and it can't come back up. You see that? When it comes down, it locks back up into that piece right there, and it can't come back up to stick someone. But the 17 gauge, is the first needle they use to start you off with when you get cannulated. Now, a graft, right, is a piece of man-made blood vessel. It's like a flimsy material like this, but a little softer, flexible, and it goes under your skin. It is used to connect an artery and a vein together. So I want to show you a picture. And if you can see, this is the, wait a minute. Right here. This is the vein. I mean, this is the this is the fistula right there. The artery and the vein sewn. And you come down, and this is the graft. Matter of fact, let me get this diagram that I have. Hold tight. Hold tight. I'm going to actually show you and put it up on screen. Here we go. Give me 1 second, guys. Thank you for bearing with me. Here we go. Now, here we go. Now, as you can see, on the right side is a graft, and you can see the man-made piece of material inside the arm. And you can see the two needles on each side, one on each side. On the other side of that to your left is the fistula, AV fistula. So again, on the right is the AV graft, which stands for arterial venous graft. On the left is AV fistula, arterial venous fistula. Okay. Now, a catheter, now I have that, you can see. A catheter is a plastic tube placed into a vein in the neck, chest, or groin. Now, this is one catheter right here. This is called a permacath hemodialysis catheter. And it goes into the subclavian vein, and the tip rests in the heart chamber, this piece right here. And you see you got the two caps, right? The clamps, the caps right here where you take off and attach two 10cc syringes on each end, aspirate the blood out, clamp, and then he go right here where it's sutured into your skin. And then this goes into your vein under the skin. and this part rests in the heart chamber. So then you have, this is the IJ. This one is used when they want to do quick dialysis. When you come in and you don't know what's wrong with you, and you end up in the emergency room, and you find out that you need dialysis to help you to breathe, then they put one of these in to start dialysis quickly. And that's where we come in to the hospital. We get that call about 3, 4, 2 in the morning, and we go in and starting dialysis. And what happens if they put this in or the other one, right? We got to make sure that it's confirmed. The placement is confirmed by a X-ray. Normally, when they put the this one in, we have to confirm it by a chest X-ray to make sure get like a pneumothorax where this goes through the vein or something like that. So again, you have the IJ where you got the red and the blue, and then you had this piece where they put in medicine. You got a little clamp line right here. It's like we call it a piggyback or a pigtail. Catheters may be used for a short time while the fistula or graft is healing. So normally when they put the graft or fistula in, you'll have the catheter, and once you're ready to use the fistula or graft, we have maybe 3 successful cannulations with the needles. Then we make an appointment for you to get the catheter removed. In some patients with very poor veins and arteries, a lot of patients have poor veins and arteries, a permanent catheter may be placed in the chest. You may ask, why is a vascular access important to me? Your access is your dialysis lifeline. You may hear a lot of warriors say, this is my lifeline, this is my supply line. Your access is your dialysis lifeline. You have only a few sites for vascular access, just a few. It is important to care for your access so it will last as long as possible. Please, guys, share this broadcast. Share this broadcast. We need your support. We need to make this go viral again. Out of 700,000 people on dialysis, 3 people on the broadcast. That's just incredible. I mean, I know there's other things on TV to look at, but if you're on dialysis, you just started, or if you at stage 5 or 4 and you just recently got an access, or your mom or dad or uncle, or somebody who just recently had a dialysis access placement, this broadcast is for them, because a lot of times they don't give you that education when you get the access put in. They may, but now with the COVID-19, who got time to do that when they're trying to protect the patients and do what they need to do to make it home safe? So let me see. Went on to why vascular access is important. Your access is your lifeline. You have only a few sites for vascular access. It is important to care for your access so it will last, again, as long as possible. What happens in access surgery? A lot of people don't know what happens. You go to a lot of the Facebook sites, Facebook groups. I don't belong to any anymore. So please, and I'm not trying to be mean or anything, don't send me for any invites to groups. And I'm not, being nasty about it, but I figure like this. I try to share information in a lot of groups. I went in the groups and saw a lot of the groups that I posted information in were pending. I'm talking about like up to 100 posts that I thought were being displayed on the page were in the pending section of the group. I had it. We have a platform, Urban Health Outreach Media. If people want the information, they know where to come. So with that being said, you go into a lot of groups and you see people posting that they're about to have access surgery, or their husband or their spouse about to go get a fistula or a graft, or they had problems with it or something. You see something with someone having a problem going to get surgery, something with the access. And you're going to tell me 6 people who may, out of this 6, you may have one person may have a transplant, or 2, or maybe 1 that's, I don't know. But it needs to be more people on here getting this information. That way you won't be blind when you go to your surgery and situations happen. You know how to respond. So what happens in the access surgery? I want to tell you. A fistula or graft is most all. Let me put it up there so I can make it real. Let's make this real, because a lot of people will be getting this placed in their arms. A lot of people, 700,000 each year diagnosed. You have people who had transplants that fail and end back up on dialysis. They still had their access. So who's going to do the education on this? If the units are not sitting down with you discussing this, they can't go to everybody's chair. You got people sick from the coronavirus, staff shortage. Who's going to give you this education? Hey, Jim, this needs to be shared. It needs to be more than 5 people on this broadcast. So let me tell you what happens in the access surgery. A fistula or graft is most often placed in an arm, but sometimes in the leg. How many warriors have access in their legs? How many? Or how many people you know have an access in their leg? I've seen many. Many. Your doctor will decide which type of access will work best for you. But I beg to differ. You are your own advocate. You may not want to access in your arm because you may not want people to see it. Or you may want to use both of your arms and you may want to place it in your legs. You had that option. But how would you know if someone didn't tell you? Ask your doctor if a fistula will work for you. But again, you're your own best advocate. Surgery for a fistula or graft is often done with local anesthesia on an outpatient basis. Medication may be needed for mild to moderate pain. Sometimes swelling of the arm may occur for a few days or weeks. When can your access be used? If you get a fistula or a graft, when can it be used? It is best to create an access before it is needed for dialysis. That's what they want. But you got some people who want to wait till after they start dialysis, or you got some situations that may occur that people don't get the surgery for years. I've seen it because they scared to death of needles. They seen people in the unit get stuck, and you hear the holler throughout the unit. Ouch! 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 It's hurting. Ouch! I mean, how many people go to dialysis units heard that echo throughout the unit with these needles right here? How many people heard the echo of screams when someone getting stuck and you say, oh my God, I'm not getting this. I don't want this. Come on, give me a thumbs up if you been in a situation and you started dialysis and you was in a unit and you heard someone getting stuck and they screamed to the top of their lungs and you like, oh my God, I'm not getting that. I'm keeping this catheter until I get a kidney transplant. Give me a thumbs up. This is a 15 gauge needle. 15. Look at that tip, right? 15 gauge, 1 inch sharp needle going into your arm. 2 of them, 3 days a week. What if the technician who's sticking you messes up and doesn't get it and got to keep digging in your arm? How many warriors experience that? Give me a thumbs up if you had a technician, a new tech, or a new nurse, or even a veteran stick your arm and then they had to stick you another time. Instead of 2 times, they had to stick you 3 or 4 times. Come on, I know it's some warriors out there that experience this. It's 700,000 people on dialysis. I know someone experienced 3 needles or 4 needles getting stuck. So, surgery for a fistula or graft is often done with local anesthesia on an outpatient basis. Medication may be needed for mild to moderate pain. Sometimes swelling of the arm may occur a few days or a few weeks. I've seen warriors arms out to here, like for weeks and months. I've seen warriors whose arms look like Popeye down here. One arm is huge, like lymphedema, and the other arm is normal. Yes. When can the access be used after surgery? A lot of warriors in groups want to know, when can they use my wife's arm? The caregivers asking this. When can they use my husband's arm? My husband had to go to surgery. They had some issues. My wife had to go to surgery for an arm. When can they use it? The catheter is not working. The machine keeps going off. The blood clotted in the machine. When can they use her arm or his arm? Well, let me tell you, it is best to create an access, as I said before it is needed for dialysis. But a lot of warriors don't go for that. If a new access is used too soon after surgery, it could be damaged. How many warriors had their arm damaged? Come on, guys. I know someone watching this or know someone who had a technician or nurse damage their arm with these needles. A new fistula should ideally not be used for 3 to 4 months after surgery. Yep. 3 to 4 months. Because you got to do the exercise, right? Especially if you get a fistula, you got to build that vein up, right? You got to do some exercise with a stretch ball or something, tennis ball, putty, something to build that, to dilate that vein. Put a tourniquet on each day for a little bit and squeeze your arm. What should I do after surgery? What should you do? As I just said, exercise that brings more blood flow to the arm can help a fistula to work better. Squeezing a rubber ball many times a day can help the fistula mature or become ready to use. Sometime at the access places, they give you these spongy things shaped as a kidney. We have them, but I think we may be out. They're little, they look like kidneys, and you squeeze them, and it helps build up your blood flow, your vein in that surgery arm. So you definitely got to exercise with that tennis ball, putty, Play-Doh, something. One of those exercise things that you squeeze for your wrist, that'll definitely help dilate the vein. Now, how can you keep your access working? How? How can you keep that access working good so you don't keep going to the access center? Or you don't keep getting surgeries? You know, I've seen people have multiple access. I'm talking about one here, then you go to the other arm, you got one here. Now they're in the leg. Come on now, that's ridiculous. That is absolutely ridiculous. So let's talk about how you can keep your access working. Let's talk about the problem. You want to avoid an infection. You don't want no infection in your access. I've seen people have an infection in their access and they had to get the access taken out. And they said that was a lot of pain. A lot of pain. So how can you prevent it? Keep your access clean. Soap and water. Be sure your access is washed with antibacterial soap and iodine or alcohol before it is used for dialysis. That's why I mentioned the show the other night. When you go to dialysis, make sure you stop by that sink and wash your access before they put that needle in your arm. Even before they clean your arm with betadine and alcohol, make sure you wash it with soap and water. Tell a nurse if your access is warm, red, has pus, or you have a fever. What should you ask? And look, even if your mom, dad, cousin, you're a caregiver, this applies to you to be an advocate for your for the person that is on dialysis that you're caring for. How should you clean the access? Do I need to cover my access in the bathtub or shower? Can I swim in a pool or a lake? Who should I call if I have an access problem? Let's move on to a second problem. I want to avoid blockage. How can I prevent that? How can you prevent a blockage in your arm or going to the access surgery center from getting those declots or stop preventing your arm from working? Learn how to feel the thrill, which is the vibration, and listen for the bruit, which is the buzzing in your access. Very important. Even if you have to get a stethoscope, right? What the nurses use to listen to your heart and lungs. Go to the drugstore, get one of them, or use your finger, and then you can listen, right? For the brew it with your ear. Place your access close to your ear and listen to it. Tell the nurse, right, if the thrill or brew it changes. Also tell the nurse if your hand is cold, blue, numb, painful, or hard to move. What should you ask? Can my doctor or nurse tell that my access is not working? Absolutely, they can tell. How do they know? Because each time before these needles are placed in, right? After we clean your arm, we're supposed to do an assessment of your arm to see if it's working before we cannulate. A lot of people don't do that. They cannulate and then find out that the arm is clotted. Come on now. You should have known that before you put the needles in. How many warriors watching this broadcast experienced that, right? They didn't listen to it, they didn't feel it, or they felt, and then they just like pushed the needle in there. Didn't even do like a thorough check, and then they digging around, and you pulling back, you sitting back in the chair like, damn, you're like, come on now, get that needle in. Next thing you know, you see black blood, right? Let me show you. Next thing you know, you see black blood right there, right? Come in the needle and stop right there. Blood is dark, right? And you like, what's going on? And they like, wait a minute, let me go get the nurse. Nurse comes. Look at it. The needle, they still got the needle in your arm halfway sticking out, right? And you like looking down at it, halfway sticking out. Like, what the heck is going on here? Nurse comes and look, it's clotted. And you look at him like, what? It's clotted. We got to send you to the access center. Damn. How many people experienced that? How many? And now we filling out a form, schedule form, ask you, did you eat before you come to dialysis? Did you have anything to eat or drink? Car come here, pick you up, take you to dialysis, or are you available tomorrow or something? Something that throws you off, key, and just put a monkey wrench in your plans. So, if your access is blocked, you may ask, can it be fixed and how? Yeah, it's called a thromboectomy, where they go in and clean out the clot and open the access up. Some people, because of their veins and what's going on, they may have peripheral vascular disease, PVD. When that happens, they may have to get another access, and they may not know about it. And that's why we do these shows. I don't want to injure my access. That's a problem. How can you prevent it? Learn how needle sites are rotated. How many people seen people with these large bumps or knots on their arms? Those are called aneurysms. And that comes from sticking at the same spot each time. A lot of people like that because it doesn't hurt once you get used to going in the same spot, but you got to rotate. Be sure the right site is used at each treatment. Do not carry heavy weights across the access. Avoid pressure on the access during sleep. Avoid tight clothing. Do not allow blood pressure or blood draws from this arm. If you go to the emergency room or something because of this COVID-19, don't let nobody, and I mean nobody, stick your access or draw blood from your access. I don't care who it is. The only person that should be doing that is the dialysis staff. What should you ask? What is the needle rotation pattern for your access? Ask them, what's the needle rotation pattern? How much weight can I carry safely after surgery? When can I carry more? Can I wear a watch or hang a purse over my access arm? How can I avoid sleeping on my access arm? Because if you sleep on your access arm, you can compress it. If you're laying on it, you can compress it and stop the flow, the blood flow through the arm. All right, so let me just go over some more stuff right quick that I think you should know. I want to be talking about basic steps in fistula or graft care. Come on, guys, share this broadcast. Share this broadcast. We need 50 people. I mean, we always talk about, they don't talk about kidney disease, mainstream, and this and that. Here we are. Here we are. We got our own format, platform, education going on. I mean, this, if you're on dialysis, in-center hemo, this applies to you. This applies to you and everyone else on dialysis, your loved ones that should be getting this information right now. So, basic steps in fistula care, fistula graft care. Right after this. All right, guys, come on. Let's talk about it. Basic steps in fistula or graft care. Share this broadcast, man. I'm telling you, share this broadcast. You're not going to get any information like this anywhere else. And I'm not saying that to be bold or anything like that. But if you go on here, you find me a broadcast that's sharing information like this, and that the executive directors on the broadcast sharing the information from the organization. You showed me that, and I can't tell you give any money, but I'll say, okay, I was wrong, and I would admit it. But I don't think there's anybody out there that's like getting in the nuts and bolts of education, right? The nuts and bolts of this. We're talking about basic steps in fistula or graft care. And how many people have a fistula or graft? Many. So let's talk about the cannulation procedure. The cannulation procedure. You may say, what is the cannulation procedure? The cannulation procedure, right, is when the warrior is getting stuck with the needle. That's the cannulation procedure. First thing you want to do before they put the needle in the access. One, you want to wash the site. That's why I said go to the sink before you sit down and wash your access. Two, you want to perform hand hygiene. Now, this is for the technician. So what I'm telling you, the technician or the nurse should be doing this. So as I tell you, you'll know the procedure for them, right? So you'll know, you'll be armed. See, this is a procedure. See, you see where it says cannulation procedure? So what I'm saying is, as I tell you, you can write this down or come back and reference it or put it in your memory bank when you go to treatment. They stick your arm that they're doing something similar to what I'm talking about. And it's 7 steps. I said 1, wash the site. This is what they should be doing, washing your access site, whether it's with betadine or alcohol pad or whatever they use. They, meaning the tech or the nurse, perform hand hygiene with the sanitizer, hand gel, or wash their hands. 3, put on a new clean pair of gloves, like the gloves that they use to wash your access down. They need to change them. Then hand sanitize and then put on a new set of gloves. 4, wear proper face protection. Number 5, apply skin antiseptic and allow it to dry, meaning on your access. Number 6, insert needle using aseptic technique. Number 7, remove gloves and perform hand hygiene. Let me tell you, you may say, Steve, what is aseptic technique? What is aseptic technique? Aseptic technique means taking great care to not contaminate the fistula or graft site before or during the cannulation or decannulation procedure. Yes, there's a decannulation procedure, meaning removing the needles from your arm. Yes. They just don't put you on, and then when you come off, they just yank the needles out. And if they doing that, they dead wrong. It's a step. It's basic steps in the care of your access when they do this. Number 1, perform hand hygiene. Wash your hands. 2, put on a new clean pair of gloves. 3, wear proper face protection. Sounds familiar? 4, remove needles using aseptic techniques. How many people had needles removed? They just yanked it out and that hurt. Not, technicians and nurses not taking care to ease the needle out. They just yank it out. 5, apply clean gauze, right? Or bandage to the site. And they're supposed to open it like this so they don't touch it. Just like that. See, this was sterile in here before I opened it. And they're supposed to open it like that and not touch it. And then they place it on the chucks, right? They got the gloves on, right? They fold it up, right? Put it. How many Come on, y'all. Give me some thumbs up. How many know about this? Got the needle in, right? You got this, right? How many warriors out there pull their own needle? You got it like that, right? You holding it, and you boom, you pull it out, and you holding it. How many? Come on, I know it's somebody out here watching that does this themselves. Go to the other arm, right? Got your 2x2 right here, right? You holding it, and you got your glove on too, right? You ready? And they pull. They pulling the needle out, and you holding it, and they putting tape on it. You sitting there in the chair, right? Holding the needle, watching TV, got your earplugs on. You know, you got some warriors holding their sight, right? They're not paying attention, holding the sight. Next thing you know, they're watching TV, right? And they holding it and they think they got it, and they may fall asleep. And they lit up. Next thing you know, blood all over the place. How many warriors experience that? You holding the sight, right? You may be new to dialysis. There's nothing wrong. And you didn't know. And you tired, right? You holding it. You just went through 3.5 to 4 hour treatment. You fall, you know. Next thing you know, you feel something warm on your arm, coming down your arm. And next thing you look, is blood all over the place. It happens. But you know what? The technician should have been there to see that. Or, made it, tape it down really well. But it happens. It happens. Apply the gauze, bandage to the site, compress the site with clean gloves, remove gloves, and perform hand hygiene. All right. So as I we got about 10 more minutes, but let me tell you something. I want to tell you how you can tell if you got an infection or not, to look for an infection. If you have a fistula or graft, you want to look for signs of swelling, redness, drainage, heat, pain. So check this out. You can have an access infection, COVID-19. Like, say you go to the unit and you got a high temperature because of bloodstream infection, right? And they say you're quarantined, but you don't have no cough, but you have it could maybe get, because of the panic, could be inadvertently be mistaken for COVID, and you can have a bloodstream infection. So again, these are signs and symptoms of a fistula or graft infection: swelling, redness, heat, pain, fever or chills, absence of vibration, which is the thrill, or sound is the bruit. Again, as I said, use your access site only for dialysis, especially if you end up in a hospital because of COVID. Don't let nobody draw no blood from your access other than the dialysis nurse. Be careful not to bump or cut your access. Do not wear any jewelry or tight clothing over your access location. Do not scratch your access, especially with your fingernails, or pick any of the scabs that may be healing. No matter if they itch or not, do not scratch it, because if you got fingernails, you may have dirt under that can give you infection. Do not sleep with your access arm under your body or head. Do not lift any heavy pressure on your access arm. What else we got here? Check the pulse every day. Check for the bruit and the thrill. I mean, just listen for the brew it and feel your arm each day to make sure it's working. If you got a catheter, the same. Make sure from the exit site you check for swelling, redness, drainage, heat, pain, or fever or chills. What else we got here? Again, it's very important to access washing. You should wash your hands and access with soap and water before entering the clinic. Now, this stuff is from 2008, and it's telling you then. And here we are now, still trying to promote this in wake of the COVID-19. So that's what I'm saying. This should have been done long ago. And a lot of warriors know that. Should have been washing hands, and what we're doing to trying to protect ourselves against this quote virus. We should have been doing this protect a long time ago. If you're in the unit, try to keep your access visible at all times. They're supposed to be monitoring your access during treatment to check for problems such as needles that may have come out of your arm, because they do come out. Needles do come out the arm. I'm telling you, I experienced it. Bleeding from your access. I've seen people had their arms under the covers, and next thing you know is blood on the floor, and you're like, what is going on here? And you lift up the cover, and there's blood all down the side of the chair, under the seat, and he's like, what is going on? It's like, next thing you know, the blood is coagulated under the chair. You see us throwing bleach water down on there, getting it up, wiping it, and putting it in the trash can. How many warriors seen that or experienced that? We want to make sure there's no swelling in the arm. Maybe the catheter lines that separate. Kink lines. So, also, big no-no and very important, do not cover your access or face. Because especially if you got your face covered and you pass out, we may not see that or know that you're passed out. And then we can't do no interventions. So, with that being said, we got about 5 minutes. Let me see. Let me go over the comments. We got many comments. God bless you. Let me just go through. Miss Kathy, God bless you. Love you. Thanks for chiming in. Pulled my IV out before. Okay. Yes. Gotta be careful. I had pulled a needle out, but not on dialysis. I worked in a hospital, for 20 years, but never worked in dialysis or had one on dialysis. So this, I am wanting to know in case I get on dialysis. We're going to hope you don't get on dialysis. Absolutely. We're going to hope that doesn't happen. Pray, not hope, but pray and make sure it doesn't. Thanks, Jared, for tuning in. It's Jared Brown, host of the Warriors Quest. Thank you for sharing, Miss Kathy. We appreciate you. Angie Essery, thank you for joining. I had to have buttonholes established because they didn't have enough spots to rotate. Yeah, I definitely remember buttonholes, and I would encourage that because the buttonholes, you can go in the same spot and you can do it yourself. Are you doing that yourself, Angie? Did they establish the tracks and you're sticking your own self, removing the scabs and stuff? Because once you get that track situated and get the scab off, you go right in and boom. Yep. There you go. Cannulate equals stick it. I like that. Don't let them ever take blood. Yep. Thank you, Angie, for chiming in and re-acknowledging that. The thrill. Yep. Yep. Thank you, Angie. Don't sleep on. Yep. Thank you for that. Jared, yep, thank you. It is a good tip because a lot of people don't know. A lot of people may not know this, especially first starting. They may be overwhelmed with so much information that they're not going to think about this, especially when they get the access. It's going to be overwhelming. Why should they think about what's the advantages or disadvantages, or sleeping on their arm, or should they check it for heat or anything like that unless somebody tell them? Yes, Angie, how would somebody know that? That's the point with this broadcast. We got to educate. Absolutely. Don't carry bags on your fistula arm. Jared says keep it clean, take care of it. Absolutely. You don't want to get an infection. Jared, it happens all the time. I'm telling you guys, share this broadcast. Hey, Mr. Vincent, thanks for tuning in. God bless you. Yes, Jared, we got to share this to make people aware. Seriously, guys. I mean, no other organization is doing this. I know I keep saying it, but just go on and look for Access Care. You may find it on YouTube, but you're not going to find, well, I ain't going to say you're not going to find a nurse, but I don't know if you're going to find somebody who's been doing this 33 years that has a range of experience doing this and sharing firsthand knowledge. Good evening, Miss Betty. Thank you for tuning in. Good evening, Angie. You know, I didn't mention buttonholes, but you're right. And thank you for mentioning it. I was just talking about fistula graft in general and the access. I didn't get into the buttonholes, but thank you for bringing that up. Very good point. Jared Brown, host of Warriors Quest. Many people need to take it more seriously. Angie chimes in. Glad my fistula has been worked. Oh my God, 14 years. Yeah. Yeah. I know somebody who's had it for 30 years, but she's passed away. Her name was Josie. She had it for 30 years. A fistula. Never had a problem with it. It could have clotted, but she never had to get another access. 30 years, AV fistula. Wow, 14. Wow. That is awesome. Wow. Angie says, staying isolated, but surprised how many do not take the COVID seriously. Got dialysis tomorrow, but always worry I will get sick when I go. I know, Angie. You know, I can't imagine, you know, from a patient perspective, but what I can say is from a healthcare, from a nurse perspective, and if you're not already doing it, I mean, of course, the mask, make sure is really tight around. Really, the N95s, you got to get fitted for that. You got to do a mask fit test, and they had to spray something under the mask, and that's how they seal that. But get that mask, seal it. If you got some glasses, maybe some goggles that you can get, maybe some clear plastic glasses to cover your eyes. Just no bifocals or anything like that, but just like what painters or people wear, right? Cover your eyes. And I would recommend when you go to dialysis, wear, if you got some gloves, right? Wear one glove to open the door handle. Use that same glove to open the door handle into the unit, right? Then take it off. Wash your hands at the sink, right? When you go into the bathroom, use a glove. If you can't get a glove, you find one of those bleach wipes that they have in the sink, right? Because a lot of units, you know, they prepare these bleach solutions where they put the rags in so they can soak up. So when you come off dialysis, they wipe your chair down the machine. You get one of them and wipe that door handle off, because there's plenty of people coming through that door each day. If you got a 30 or 40 chair unit, how many people are opening that door? How many people wash their hands? How many people went to the bathroom and didn't wash their hands, right? So you got to look out for yourself. And the way to do it is just being prepared in the know-how. So yeah, if you got to go into the unit, just try not to panic. I'm not talking about you, Angie. I'm talking people in general about fearing that you're going to catch it, because everyone should be having a mask on at the unit, and just try not to touch anything. This is what I would do as well. I would wear, if you have a certain set of pajamas or old clothes, sweatsuit or whatever, old tennis shoes, sweatpants or something, pajamas, shirt or something that you don't need, wear that, right? And then before you go in the house, maybe depending on if you live by yourself or your family, make sure somebody have a set of clothes or something you could change into. You could take off the clothes on your porch or before you get in the house at the door if you don't trust it, whatever, but have a bag that you can have at the door. Take those clothes off, put it in the bag, take it downstairs, throw them in the wash machine, bleach it, whatever you do, and then with your clothes off, or maybe with your underwears or shorts, whatever you got under those clothes, have you want, sports bra, whatever, go upstairs and get in the shower, and you're clean. Try not to touch anything. I mean, there's certain ways to do stuff without, really panicking. Let me just share this before I go. My anxiety when I get up in the morning, and I pray and everything, but mine is not knowing like what's the next move. It's almost like a chess game, because I don't watch the news. I try on my, I go on my timeline. Anything I see about the COVID virus or whatever, I hide the post. It can be any comment, I hide it, because what I see on Facebook and what I see in my community, it doesn't reflect it. Now, I'm sure people are, I know people are probably dying, but in my community, that's not a reflection of what I be seeing on Facebook when people talking about the National Guard, 5G towers, this, that, shutdown. What was one I seen? The governor in Florida going to do make people take the vaccination or throw them in jail. Maybe true, it may not. I don't want to hear it. When it comes knocking on my door and that's when it's going to happen, whatever, then I'll address it then. But once I get past that within myself to accept one day at a time, I always talk about it, but now it's really practicing one day at a time. The days of, next year I'm going to go to the Bahamas, or next year I'm going to do this. That's no longer an option now, because we don't know, based on this, whatever's going on with this virus, if we'll be able to travel to any other country again. Will it ever be the same? Would you trust going to Dominican Republic or Miami or wherever these hot spots are. Will you ever trust going there again? So I just literally take it and keep practicing one day at a time. Sometimes it got to be a damn hour at a time, because with so many COVID-19 response team reports and this and that, and with the news, and man, I don't even want to hear it. That's like I said, I don't even watch TV. I watch Netflix documentaries, right? I don't watch no Pandemic or no Contagion, none of them movies. You got people watching. Let me just say this before I end, right? I swear, I'm not the smartest guy in the room, right? Sometimes the elevator doesn't go all the way to the top, or something may go over my head and I may not catch it. But what I can tell you, I always try to practice logic, right? Now, you got people who watch the movies, and that's great. If I watch movies sometime, again, I don't watch no Pandemic, Contagion, stuff like that. And here's why. Even though art may imitate, real life may imitate art, where you see this and it's like everything is happening just like on Pandemic or Contagion. I've seen the post. Have y'all seen Pandemic? Everything is happening the same way. There's martial law, this or that. It may be true. However, let's use logic. In Contagion, Pandemic, or Outbreak, any of these movies, those are actors. You have someone acting a part. It's a person acting a script. What happened in the movies doesn't mean that people in real life are going to react the same way. You're playing a part, for God's sake. So the real life, quote, bullcrap hit the fan. Somebody in real time, in reality, is going to act totally different than someone acting that part in the movie. So just remember that. Even though things are set up the same, framed up, National Guard is out, this or that, people in real life act different than actors. That's why they actors. Actress. You had people playing those parts. Dustin Hoffman. Come on, guys. So, yeah, this is the thing. If you want to scare yourself to death and worry, because we know as human beings, we worry. Now, we say faith without works is dead. We can say that and talk up, but we all, I don't care who you are. You could be Jamal Bryant. You can be Creflo Dollar, Joel Osteen. I don't care who you are. We're all human. We all fall short of the glory of God. We're human. So I don't care what anyone says. We all have fear some way or another. We all experience it. It's how you manage these emotions. That's right, how you manage it. So with that being said, with that being said, guys, if you believe in a higher power greater than yourself, whatever you may call it, the doorknob, God, Allah, whoever you seek for higher wisdom and enlightenment, that's who you should depend on. The person who woke you up this morning, or entity or deity, whatever has you watching this broadcast, breathing, able to hear, able to see, whatever, that's the entity that you need to rely on. Because I don't rely on no Facebook post talking about coronavirus, because no one knows other than the people who set that in motion. No one knows. We can all speculate. And please, let me just say this. Stop sending me videos. If you're sending me videos through Messenger, I'm like, blocked you from sending messages, right? I don't want to hear any conspiracy. None of that. However it's going to fall, it's going to fall. And whatever conspiracy is, whatever conspiracy that happens, whether they put the chip in your arm or 5G towers or whatever the case may be, martial law, what are you going to do about it? That's my question. It ain't like you can fight back. I mean, you can, but they got bigger guns than you do. Technology. I mean, what are you going to do? Take it one day at a time. And that's what I want to do, and confront whatever's going to happen when it happens. Because worrying about what's this going to happen, the radiation, I'm going to do. All I can do is prepare, be precautious, look out for my parents, kids, my daughter, and go from there. So, guys, thank you for watching. That's just my 2 cents. I do worry, but I also believe in a high power that's going to see me through, that saw me through in a lot of situations. A lot of you see me last summer when my eye was had a torn retina, and I was going through that period. I had the patch on my eye. I was scared to death. I was scared to death. And if it wasn't for, and I always say, is even though she's not with Urban Health Outreach Media, Stephanie Mo Davis and my ex-wife, Karen Belcher, and my friend Allison Coleman, and other people, Tamika, Don, Jared, Lisa Baxter. Without them guys, man, I would have been nothing. They guided me through, had people praying for me, because I couldn't pray for myself because I was so damn scared of losing my sight in my right eye, not able to see, and waking up seeing blurriness. Man, that is the most scariest, to me, one of the most scariest events that I have experienced, other than my sister passing away. So, all right, guys, thank you for watching. Be on the lookout tomorrow. Going to do another education session. Not sure what it's going to be, but it's going to be very exciting, educational, something that you can apply to your life, especially if you are a kidney warrior or a family member of a kidney warrior. You're going to be able to use this information that I'm going to put out, okay? So stay tuned until tomorrow. I don't know what it's going to be, but I'm going to give you plenty enough time to be able to respond and tune in. So thank you, Jared. Thank you so much, man. I appreciate you. God bless you. Jared Brown and his brother Jeffrey met on Facebook. His sister-in-law had a transplant, and God linked us up. And we've been working together for maybe about almost going on 2 years, Jared. What's this? 18? Yeah. It's going on 2 years this May. I believe your sister-in-law had the transplant. And that we started seeing y'all post. So guys, thank you so much for watching. We love you. Share this broad. We know you could be anywhere else other than here. So we thank you. A show in advance what the topic's going to be. So be on the watch. Also, Friday, the new group is going to be popping. That's the Urban Kidney Alliance Patient and Family Virtual Support Group. And let me just share one thing about this group, how it's different from any other support group on Facebook, especially kidney disease. We're going to have a broadcast just like this, and we're going to have a facilitator and a co-facilitator, right? And we're going to have 4 slots where warriors can come on, or family members can come on the box. This broadcast where you see me at right now broadcasting, we'll send you a link, and 4 people could be able to come on the box and be able to share their experience, strength, and hopes based on the topic that we're talking about. And this Friday, our first topic is going to be family life and kidney disease. How has kidney disease impacted your family life? How has it? I'm sure it has impacted a lot of family member and warriors' life, right? Hey, James, hey, buddy, thanks for tuning in. I'm not sure if you got my email, but I definitely sent you one about this Thursday. So let me know. But yes, James, a virtual reality support group, right? And you can even do this too, man, with the coach. You know, have like round robin discussions and bring your audience in, right? Okay, I want to check it. I check it once I get off the broadcast. But yes, a virtual support group where 4 people could come on, whoever wants to come on and share has impacted your family life. And so the neat thing and I'm going to send you an invite. The urban and virtual support. That's the only way you can or Al-Anon support type group online. Everybody can see this. Not every group member. The only requirement that you impact kidney disease. Your caregiver, you got kidney disease, transplant, rejected. You're in one of the 4 or 5 stages, right? Your family member, your mother, your brother, your sister, your uncle, somebody that means something to you is dealing with this disease, and you need to share and express those emotions or feelings somewhere where other people can understand and know what you're talking about. You can't do this in a lot of these Facebook groups. You can write down your emotions or your feelings in a post, but that's coming from you, but it's not the same as verbally expressing it. Yes, writing it, expressing it is helpful, but people misinterpret posts all the time. You see it all the time. You type something down, you write something, and somebody says something and took it the wrong way or didn't know. And or maybe you was offended because they asked something or said something and didn't really understand what you wrote. That's why Urban Kidney Alliance, patient and family, writing it down. It could be just like you're at a meeting. Like when you stand up, whatever meeting it is, it could be food or whatever, breast cancer survivor, whatever the group is. Only thing is you're not, you can't stand up and say, hi, my name is so-and-so, I have kidney disease, right? And whatever's on your mind. If you don't want to talk about the topic, you can say what you're going through. Today, I'm so pissed off. I was at the dialysis unit, and lady from the nursing home took off her mask, and she's coughing all over the damn place. The staff doesn't say nothing to her. I'm sitting right next to her. No one's listening to me. I don't want to catch the damn COVID-19. I mean, say if you by yourself and this is what you feeling, who are you going to say that to if you don't have nobody at home living with you or no friends? Who are you going to express that anger to? You can express it right in the Urban Kidney Alliance patient and family virtual support group, because the rules have already been set. There's no judging. None of that. Confidentiality. If the confidentiality is broken and we hear about and find out who broke the anonymity, they banned. We take this serious. And we know during this time right now, there has to be an outlet for warriors. If you can't get to the psychologist, or you don't have telehealth to see somebody to speak to, well, you can come to a group, a virtual group, and listen to a broadcast in real time or participate in real time what you're feeling, get it off of you, and have other members being used as a sounding board. As a sounding board. Because the people in their group are more likely going through the same issues or similar ones, just like you. And you know what the common denominator is? It's the same as the requirement for membership. Kidney disease. Kidney disease. Doesn't matter if you're black, white, pink, red, green, whether you male, female, straight, gay, whatever gender, whether you're Lutheran, Baptist, Christian, Muslim, it doesn't matter. As long as you're not racist. But even if you're racist and you don't display those racist behaviors and attitudes toward anybody in the group, and you got kidney disease, you need the information too. Right? But this is what this group is all about. Support. Again, as you can see, this is our page. Well, the broadcast before, when you come into, we call it the room, where the group restart, you'll see this. There's no color here, even though you see all white hands. But the point is, this is open. We just need your support. Come in. Again, the only requirement for membership is being impacted by kidney disease. So thanks, guys. I really appreciate it. We got up to 31 people. We're going to get 50 one day. I promise you. I promise you we're going to get 50 people in the broadcast. I long for that. Let me tell you something. God bless him. This is a guy I met. His name is Douglas Lewis. He was born with Pfeiffer disease. Look that up. He's on Facebook, but he's a comedian, right? He got bullied one day on Facebook. I mean, really, really bad, right? And from that, he like turned it around and started being a comedian. But I swear to you, type in his name, Douglas Lewis. He has Pfeiffer syndrome. That's what he was born with. All these it had to do with the brain. The cranial structures and stuff. I mean, he was on Oprah. I mean, multiple surgeries when he was a kid. But this guy's a comedian, right? I mean, he's on this live with a pamper on, a hat, and he's kind of overweight. But he has a pamper on, these fake teeth, and he be dancing, right? Be dancing, guy maybe in his 30s, right? You know how many people here on this broadcast? I saw this right yesterday. This guy had like 14,000 people watching him live. He had maybe 40,000 views, 22,000 shares. Are you freaking kidding me? I'm not mad at Doug. Doug, man, I ain't mad at Doug. But the point is, you got a guy with some freaking diaper on, no shirt, a hat, fake teeth, buck teeth, a green gun, squirt gun, dancing with some music. Let me put my paws on you. Let me put my paws on you. Let me put my paws on you. 14,000 people watching him. And you look down the scroll of the feed, people laughing. Mind you, they making fun, joking, all that type. But the guy's a genius. Freaking genius. He know what he's doing. He's getting those views in. He know exactly what he's doing. Because he know people will look at stupid crap, not calling his craft, but he know people are going to respond to that, make fun of him. He already been through it. So those comments don't hurt him. The point is, this guy with diapers on, 40,000 views. 40,000 people watched this. 14,000 watched it live. 20-something thousand shares. Here we are. Kidney disease education moment. I swear to God, I love the 13 to 30 people attended. How come we need 14,000 views? It's 700,000 people on dialysis. We need 20,000 views, 20,000 shares, 50,000 views. That's what we need, and that's what we're striving for. So continue to share this video, broadcast, and we'll continue to come each day. Okay, James, we're going to definitely shoot for 50 Thursday. I like that. Dad advice. Thank you. He gave me a boost of hope. Most definitely. But guys, the point is, even with Dad TV, go over to YouTube. Look at his broadcast that for kidney warriors. Anytime you have a gentleman, his GFR was 8, on the brink, I'm sure. James was on the brink of dialysis. On the brink of it. I think they start at 5. He was at 8, 3 more points. He turned it around and went from 8 to 30 something. I think he said 35 or 33. Now, if you see someone do that and you don't have any other comorbidities, I would reach out to someone like that to find out what in the devil did you do. 33. Yep. What did you do to go from 8 to 33? Kidneys back pumping. They may not be at 100, but they're at 33. They stable and no dialysis. I mean, you have people have transplant that have lower GFR than 33. And he said he's still improving. Man, thank you. I mean, absolutely. Absolutely, James. Guys, if you're watching Dad Vice TV, Mr. James Fabian, thank you for coming by. Go to YouTube, check out his shows, hundreds of them. Wow. So, all right, guys, thank you again. This Thursday, Dad Vice TV is going to be on Urban Renal Talk with Tamika and Steve. And then Friday, we're going to have a support group. Tune in for Wednesday night with Jared Brown. Warriors Quest. He's going to have on, here the thing right here. You're going to have a special guest who is a sergeant or police officer. Audrey Lang, Bella Langston will be his co-host. It's going to be off the chain on Wednesday night, 8:30. So tune in. Thanks again for watching. James, thank you. I'm definitely going to look at the email now. Miss Mayweather, Miss Betty, Miss Maria, Miss Kathy, Angie, Joe Patterson, everyone else, if I didn't get your name, Angie, Vincent. Thank you guys for watching. I appreciate it. God bless you. Stay safe out there. And look, just take it one day at a time and just put your faith in that higher power who you've been relying on. I don't need to tell you that. You know. So God bless you. Thank you again. And stay safe. I'm out, guys. Peace.
to go down. I said y'all, it's about to go down.